We are here to give you a helpful tip of how you can save lots of money, next year, many years to come, and it all has to do with your mouth. I'm with Dr. Chuck here in Central Florida. Dr. Chuck, give us some tips on money saving.
Well, what I'm telling patients, and I truly mean it, is my goal is not to take more money from you. It's actually to take less money. But in order to do that, I need your help with what you're doing at home.
Okay.
So if we can spend that 8 to 10 minutes one time a day thoroughly cleaning your teeth, you're going to not have as many dental issues, not as many gum issues, tooth issues, root canals, crowns, fillings, all these things, dentures, partials. That's money. I would rather have you spend the time at home and not need more work.
Okay.
Prevention isn't sexy, but it saves time, money, and pain. So if we can spend that time at home, you're going to save a lot of money. I'd much rather have you spend money on your family. Mm-hmm. But if you're not going to do it, we want to keep you healthy. So I've told my patients, it says, my goal is to take as little money from each one of you as possible, but I need your help. Mm-hmm. And if I don't get your help, I've decided I'm willing to take just as much money as it takes. Okay?
That's awesome. Can you throw some dollar amounts out? I mean, and I know it's going to vary and we're not holding you to, but when we talk about saving money, like, are we talking about, a few dollars here and there, or how expensive can things be?
Well, when you start looking at root canals and crowns, you're getting into thousands and thousands of dollars. I mean, one tooth, by the time you do a root canal, post, core, crown, one tooth costs a couple $1,000.
Whew, I've driven cars less expensive than that.
So why not do these things to prevent this in the first place? Mm-hmm. So you can spend that money on a car. Mm-hmm. You don't have to spend it on your mouth. Again, Keeping this healthy is going to save you money. It's going to save you medical issues, and it can save you a lot of pain too.
Mm-hmm. I'm just kind of comparing this to if you don't exercise, you don't walk, which I'm guilty of. You have insurance that kind of covers. I mean, that sounds kind of bad, but insurance isn't quite what it is for your mouth, for your body. So there's even more inspiration. You really will pay out of pocket for your mouth.
Absolutely. And dental insurance is more like automobile insurance when you think about it. If you had dental insurance, you get 2 free cleanings a year. Mm-hmm. If you're in an accident, if it's anything over $2,000, it's out of your pocket. Mm-hmm. Okay, yeah. We'll cover the first $1,500, $2,000, but anything over that is, it's not really insurance. No. It's a supplement to help you a little bit on minor things. Mm-hmm. On major things, it's coming out of your pocket. Mm-hmm. So let's prevent those major things in the first place.
Yeah, and Dr. Chuck, if people want to get a hold of you, how can they do that?
You can reach me at AMA, which is Ask Me Anything, at the dentalmedicalconvergence.org.
And don't forget to share this information. This is so hugely important, especially with friends and family, and help them save money too. Don't just keep the secret to yourself. Yeah. Thanks for joining us today.
Thank you.